All right, well, I got my lovely assistant here, Brian, today, so I'll let him say hi too, so hang on.
Are we starting?
Yeah, I guess so. We can start.
No, cut off. Good morning, everyone. It's a little early, but the best thing about today is when we start to review these meds, you're going to quickly learn that everything you needed to know you learned in level 2, which was just a few weeks ago. So you'll see how all these meds flow back to level 2. So are you ready to get started? Let's do this and crank it out, okay? So the very first one I'm going to start off with, and Stacy's going to add in and then do a class, and we'll just keep going back and forth, okay? My head's going to get cut off because we're trying to focus on the board. So the very first thing I want to say, other than the fact that you learned everything in level 2, that during math or during any medication on any test, when something goes wrong, you always know hold and stop is what you're doing first. Because if you're getting answers such as you're infusing 1,000,000 drops per minute, you know, something is definitely off. So we have to kind of make it sense in our worlds. Okay, so stop. I know on Stacy's final, that question about the peg tube was infusing, and what are you going to do first? And some of you said, oh, assess breath sounds. Well, the peg tube was still infusing, or whatever tube it was still infusing. When something's wrong, stop, okay? That's all I need you to do. Stop, hold, and stay off the phone. Don't be farting around with the physician because you have to do your nursing care first, okay? So the very first thing we want to turn to is our cardiac medications. And you know with your cardiac medications, you can always say A, B, C, D, correct? And we're going to turn to these medications, cardiac and hypertension. You already know A stands for your ACE inhibitors, correct? And you already know from level 1 and so on that those are going to end with pril. So you know this spells April, like the month, okay? So don't forget your ACE inhibitors. Next, you know this is beta blockers, calcium channel blockers, and the next one, if we're talking about hypertension, we know we could use diuretics such as hydrochlorothiazide, okay? So what we want to do when we study is I want you to pay attention to every med that you're studying. I just want you to say, nurse. I want you to be a nurse, which means N, I need to know the name of this medication. We just said our ACE inhibitors will end in pril, our beta blockers LOL, okay? U, what is it used for? R is, what is the nurse responsible for? S is side effects, if there are any specific ones, and E is how are you going to educate your patient. So just make sure you can do nurse for each of your class of medications. All right, back to the cardiac meds. When I'm studying, I want to say to myself, what is the same among all of them before I start picking apart what's different, okay? What's the same among all of them is we know we can use these classes of medications to treat hypertension, correct? So we know whenever we're farting around with blood pressure or pulse, we already know before administration, please get me a blood pressure, please get a pulse. And of course, if it's out of normal range, what are you going to do? Don't start getting on the telephone and calling anyone. You need to do your nursing, which means hold if something is wrong, okay? That being said, again, we're interfering with blood pressure, so what's common among all of them is you know you're always assessing for orthostatic hypotension, which means your nursing care is you change position slowly, dangle the legs at the bedside, and that is your education that you are going to educate your patient about, okay? So please get me a pulse, blood pressure, and prevent orthostatic hypotension for all these classes of medications. So now let's talk about what is different. So we're talking about ACE inhibitors, correct? We're stopping the conversion of angiotensin 1 from converting into angiotensin 2, okay? We know angiotensin 2 is a major vasoconstrictor, So we want to stop that because what we want to do is dilate. Now, do you remember from level 2, which was not that long ago, when you used your ACE inhibitor? Who was the patient that would receive your ACE inhibitor? Do you remember what content that was? Hello? Is anyone awake? Oh, I see kidney, I see diabetes. No, okay? Remember, it was unload me. And what topic was that? That was the A in unload me for heart failure. So we know A for your ACE inhibitor, treated afterload. Remember that? A for A, and afterload simply meant constriction. We want to vasodilate so we can lower that blood pressure, okay? What's different for side effects? Are there any side effects for ACE inhibitors that you need to be aware of? Yes, let's talk about. They all begin with the letter A, okay? So the very first one we know will be what we call an ACE cough, okay? So it may be a dry hacking cough. In fact, if your patient is on antihypertensive, you usually know when they're on an ACE inhibitor because when you walk into the room, they're going all right, it's that dry cough that we call an ACE cough. The next one that you want to be aware of is monitor for something else that begins with the letter A, and it is angioedema, okay? And we know that swelling under the tissues, but what we're concerned is around the face, because of course, once we start swelling of the face, we can have a problem with your airway, okay? So again, here is your ACE inhibitors. Get me a blood pressure, get me a pulse, monitor for that ACE cough and angioedema. And we know this is the preferred medication for heart failure because A appears in unload me. All right, moving on. Let's go on to B, which is your beta blockers. We know what we're trying to do is block beta 1 and beta 2. What exactly does that mean? Keep it simple, please. You know beta 1, you have one heart, correct? Beta 2, you have two lungs. So what we're going to do is block the beta receptor sites in the heart and in the lungs, okay? So again, get me a pulse and blood pressure before administering these medications. And what will the side effects of these medications be? Beta 1, we're going to block beta 1, so we're going to vasodilate, which is what we want to lower blood pressure. However, it will constrict beta 2, and this means that beta blockers are contraindicated with someone with a lung problem. What condition will you avoid beta blockers in? Respiratory-wise, since we are firing around with beta 2, we know that's going to be COPD and asthma. Now, this is on your list to avoid COPD and to avoid asthma, but actually in practice, you'll see beta blockers still used. But for now, just stick to avoid with COPD, avoid with asthma. All right, you're also going to learn later on in level 3 about why you can't use the beta blocker, and it has to do with a respiratory condition with acute coronary syndrome. But for today, who cares? We're only keeping it basic, okay? Get a pulse, get a blood pressure, please. Thank you. And prevent orthostatic hypotension. Next is your calcium channel blockers. Calcium channel blockers, we know calcium is needed in for muscle contraction. So since this begins with C, you know that the purpose of this medication is to decrease contractility, okay? C for C. We know from Unload Me, you know there's no C there because someone with CHF already has low contractility. You never, ever, ever give a calcium channel blocker for someone with a low contractility problem such as CHF, okay? So I have a good question for you. Since we're blocking calcium from entering the cell to decrease contractility, how would we reverse this medication? If we're blocking calcium, what will we do? Keep it simple. You heard the word calcium, so we would give calcium, okay? But who cares? All I want is a pulse before and a blood pressure before, and just know it's contraindicated with CHF. Now let's talk about something special from level 1 with grapefruit juice. Remember that you cannot give a calcium channel blocker with grapefruit juice, because what happens is grapefruit juice suppresses an enzyme required for metabolism. So if that enzyme is suppressed, what's going to happen to the medication? It's not going to be digested. More of it's going to enter the bloodstream, causing more decreased contractility. So that is why your education to your patient is, please avoid grapefruit juice when on a calcium channel blocker, okay? But other than that, your nursing's the same. Get your pulse, blood pressure, and prevent orthostatic hypotension, and never give it to CHF or heart failure, okay? Next, D. Now, for hypertension, this would be your diuretics, but we'll talk about diuretics separately. What I want to do is talk about digoxin, which is a different class of your cardiac medication, correct? Your digoxin, we know, is the cardiac glycoside, and we give this to increase contractility or force of the heart. And you know that that was in Unload Me, so we're giving it for CHF to increase the force of the contraction of the heart. However, whenever we're dealing with contractility, you know you need to get a pulse. And what does the pulse have to be? You know, in nursing school, it has to be 60 beats per minute. It has to be your apical pulse, and that you've taken that pulse for 1 full minute. So if the pulse comes back and it is 59 in nursing school, something is wrong. What are you going to do? Stay off the phone and do your nursing, so you will hold, correct? Now, I have a good question for you. You know that whenever we're talking about cardiac glycosides, they're at risk for digitoxicity, correct? We know there is an early sign of digitoxicity and there is a later sign of digitoxicity. And what is your earliest sign of digitoxicity? You know, if your patient is on dig, you know that's nausea and vomiting. If they do complain of nausea, you will hold the medication and draw a stat dig level, okay? A later sign, what's the later sign of digitoxicity? Remember what it is? You know that's your yellow halos in vision. They may be yellow or green, but they're seeing halos. Remember that Beyonce sang about halos? I can feel your halo. Okay? Remember, she was singing about digitoxicity. She was singing that song. All right. Now, I have a question from you back to level 2, because everything you needed to know was back in level 2. What causes digitoxicity? Yes, I know. Giving too much digoxin will cause digitoxicity, but all your conditions in level 2 affected potassium, correct? So we want to watch our potassium level, because low potassium means below 3.5, we know will cause digitoxicity. In fact, remember in Unload Me, the L, we gave Lasix first. We know that's going to lower your potassium before we got to the D of digoxin, okay? So please monitor that potassium, because we know low potassium will cause digitoxicity. And that is your cardiac drugs, A through D. Do you have any questions regarding cardiac medication. Isn't it amazing how you can put the pieces together now that you've been through level 2? It all makes perfect sense. Yes, it does. All right, Stacy, your turn.
Wow. I'm just gonna go with some insulin with them.
Sweet. I don't like that.
That's all right, because I gotta make sure. Okay, I need to have a drug book, and I want you, because my drug book is a little outdated, and I want to make sure I'm giving you all the right numbers. Can somebody look in their drug book, please, under insulin, and tell me who has that? And they do have it. Somebody have it? Shoot, I can't see when somebody's, okay, all right, so just hold on to that page, Samantha, for me, okay? I don't know if they can see this very well. Should have moved it over. Okay, so remember, we're going to go over Novolog, regular, NPH, and Lantus or Levemir, okay? So those are going to still be the long-acting. Do y'all remember in level 2 what I told you about a Novolog and regular? Remember, I'm Novolog. I'm really fast, and Yolanda's regular. She's fast, but she's not as fast as I am. Y'all remember that? Because when she's chasing me, yes, see, thank you. I'm glad y'all remember. Thanks, Brandon. I remember that. So if I'm really fast, I'm the fastest one, right? So what is my onset for Novolog? 10 to 15 minutes, right? Okay. Peak is going to be 1 to 2 hours. Duration is going to be 3 to 4. If your book says different, somebody please tell me, because I just want to make sure, because sometimes these books change, okay? All right, so then I've got regular. All right. So remember, I'm really fast. Now, Yolanda's pretty fast, too, but she's not as fast as I am, okay? So she's going to take a little bit longer. So she's going to be 30 minutes to an hour, okay? Let me make sure I got that, okay? And then she's going to be, what is your 2 to 4, sorry. 2 to 4. And just making sure. Now, does your book still say 5 to 7 for duration? Yes, okay, just wanted to double check. Okay, so again, let's go back and look. See, look how fast I am, man. I come in fast, I stay, but I don't stay too long. Yolanda, she's trailing behind me. She stays a little bit longer than I do, okay? All right, and then we got Brian over here, and he's in PH, okay? So he's not fast at all.
Oh, rude.
I'm sorry, he's just not. He just likes to kind of take his time, but he's not real slow, but he just likes to take his time. Yeah, see, I'm trying to help you out here. Okay, so with NPH, onset 2 to 4 hours, okay? And then we've got 4, now y'all tell me this, does your book for peak say 4 to 10? Yes, okay, making sure, and then 10 to 16. All right, see, so once I come in, and then Yolanda comes in behind me, okay, and then Brian comes in. Okay, so he takes a while to even show up, but he's still not real slow. All right, Lantus or Levemir, who can we say is that?
Long, slow.
Yeah, but who? We got to come up with somebody's name, and then we'll remember everybody.
Let's do our boss, Sandra.
Sandra. Okay, we're going to say Sandra. We love her, but she is the slowest of all slowest. Okay, so that's what we're going to say. So for Lantus, it's going to be, what is your, hang on, I gotta give myself some room. All right, so does your book say, what does your book say for the Lantus? Because mine had said 3 to 4. Does yours say 3 to 4 for onset? Okay, just making sure. So she's not that slow behind Brian, if you think about it. Look at him. He takes 2 to 4. She's 3 to 4. So they're kind of right there. So they kind of come to the party at the same time, okay? But for the peak, they're kind of right there too. And I think, tell me again if your book is different. Mine says 3 to 14 hours. Says? Somebody? Anybody? Yes? Okay. And then 6 to 24. All right. So Sandra is going to come in and she's going to, peak kind of around the same time if you look at it with Brian, but she still takes a little bit longer. And then she's going to stay the whole time. She's the last to leave the party. I'm the first to come in, okay? And I'm the first to leave, all right? And then, but if you look over here, you got Sandra, she's Lantis or Lovamir, and she's going to be the last to leave. Rebecca, what's your question?
There's no peak for Lantis.
No peak.
Okay. Okay, that's what I'm saying. I've got an older book. Okay, well, you know what? Sandra's just, she doesn't need to peak. How about that? She's just awesome. How about that? Is that what you wanted to say, Rebecca? Whoever had a question?
That's what I wanted to say.
Okay, perfect.
Wonderful.
All right, so remember, Novolog, that's me. I'm the fastest one here, okay? 10 to 15 minutes, peak is 1 to 2, duration's 3 to 4. Then we got Yolanda. She's right behind me. She's 30 to 60. She peaks at 2 to 4. Duration is 5 to 7. We got Brian. He's MPH. He's that middleman, right? He comes into the party a little bit later. 2 to 4. Peak 4 to 10. Last anywhere from 10 to 16. And then we got Sandra. She's Lantis / Lovamir. She comes in about 3 to 4. So she's right there with Brian as far as coming in. She doesn't really peak because I guess, she's just always there. And she stays the longest from 6 to 24. Okay? Is everybody good on these? Because if I guarantee you're going to be asked an insulin question. I guarantee you that. Okay? Because they always do, no matter what. Lantis duration, mine says 24. Okay. It'll say like up to 24. Bridget, that's fine. So what they're going to do is they're going to say something like if the patient was given regular at 7 a.m., when would you expect it to peak? So you have to think, okay, my peak is 1 to 2, so anywhere between 8 and 9, all right? If you guys, now, I know that you're not going to have paper like you did, and I think your boards are pretty small, so if there's any of the insulins that you're kind of like struggling with, maybe at the very beginning when you start your test, when it starts, remember how before you could write on your paper, maybe y'all can write some tiny little notes, I don't know, because you're just going to be really limited on your space, okay? The other one is, I'm going to stop with this one, and I'm going to go on and do one more with you guys, okay? Is everybody good on this? Any questions on this one so far? You have a question, Brian?
Which one of those can I give IV?
Oh, that's right. That's a good one. Which one of these can we give IV? Regular. Okay, so remember, Yolanda's the only one that can be given IV. That's how we're going to make her feel special, okay? There you go. All right. I'm going to erase this, and I want to go over another one with you guys because y'all may have this one as well. All right, 70-30. I would not be surprised if y'all have a 70-30. The Pharm exam will be specific, and it's going to tell you, is it 70-30 with the Novolog and NPH, or is it the 70-30 with the regular and the NPH, okay? So let's go ahead and go and do all of these real quick. So we got onset, peak, duration. I'm going to do that again. That's all right. All right, let's start with our Novolog. So onset, remember, this is me, okay? So this is kind of me and Brian together as we hang out, okay? That's an easier to remember. Regular is Yolanda and Brian, okay? All right, so I remember I'm the fastest, so I'm going to kick in when? How fast is this going to kick in? Because this is me. Because I'm not going to let Brian hold me back. Right, so 15 minutes, right? So I'm 15. My peak is going to be 1 to 4. And this is what I don't understand. Does your book say 18 to 24? Okay. See, and that's so weird to me. I don't understand how it goes up to 24, but whatever. We're going to go with what the book says. Okay. So then you've got regular. So here you got Yolanda and Brian. Okay. So let's look and see what they're going to do. So how fast is that going to kick in? Remember, Yolanda's not as fast as me. And she's not going to, thank you, and she doesn't let Brian hold her back from getting to the party. Okay, so she's 30, 2 to 4, no, 2 to 12, I'm so sorry. And then duration, I think it said 24, which is weird because I don't understand how it does that considering it doesn't have Lantis or Lovamir. But again, I didn't write the book. All right, So you can see that when Brian and I come to the party together, we get there early, right? Because we don't like to miss out on fun, that's for sure. So we're gonna get there early, and we're gonna like really start dancing and having some fun in 1 to 4 hours, and it looks like we stay a pretty long time, okay? Well, when Yolanda and Brian come together, they come a little bit behind, but they still show up, okay? And they kind of peak between 12 to 4, and they stay and party all night. Got it? Is everybody good on the 70-30s? Because I would not be surprised at all if you're asked a 70-30 question. But I get you're going to have insulin, and I want to make sure everybody's good on it. Yes, Samantha.
On the book, there's only Humulin and Novolin. It's a mixture with NPH and regular. Is that right?
Well, you have to look at what it's going to ask you on it, because when they do, it's the way that they label it. So, like on your Novolog, if it's a Novolog 70-30 mix, it's going to be the insulin aspirate, and then the regular is going to be, it should have another name to it. What's the other name of the
Protein?
They'll write it out though for you. They'll tell you if it's regular or if it's Novolog, because they have to be specific with y'all.
Okay.
Okay, but there are 2 different types of 70-30s, guys. I'm letting you guys know that there are. So you have to look at it, and you have to know what the difference is between, is it Novolog in there and MPH, or is it regular in MPH? Okay, I don't see the regular used as often anymore, but there are some patients that still do it, okay? If it's, okay, Novolog and Humalog, okay, I want y'all to know, they have the same onset, peak, and duration, but they are not the same. Okay, so if you're ever in clinical and you go and reach in there, and there's always Novolog, I swear there's always there, but I don't see the Humalog in there. You can't grab Novolog and say, oh, well, it kicks in and lasts as long as, so I'm just going to use this. You cannot. You're going to have to call pharmacy and say, I need Humalog if that's what's ordered, okay? Even though that they still have the same onset, peak, and duration, they are not the same medication, okay? Are we good? Any other questions on insulin?
There's a question about mixing regular and NPH.
Okay, can y'all do that? Can y'all mix the regular and the NPH? Somebody said yes. Okay, well, if you're if you're going to do that, how are you going to do it though? If I've got regular right here, my bottle of regular, and I've got my bottle of NPH. Okay, which one is clear and which one is cloudy? Okay, somebody said clear to cloudy. Okay, so, but which one's clear? I see clear to cloudy, I see cloudy to clear. Okay, clear is going to be your regular, right? Your cloudy is going to be your NPH. All right, so which one am I going to insert the air into first? NPH. So the air first. Okay. So if my order said I needed to have 10 units of regular, and then I needed 5 units of NPH, okay? So I'm going to inject my syringe into the NPH, right? And then I'm going to put 5 units of air, and I'm going to immediately take it out, right? And then I'm going to go and I'm going to inject my air, and I'm going to say 10 units, right? So 10 units. So my last one, I'm going to inject the air, and then I'm immediately going to flip it over, right? Clear to cloudy. So then I'm going to draw up my 10 of my regular, and then I'm going to go back to my NPH, yes? And then I'm going to get 5 more. But before you ever get your second, make sure you know where your landmark is. So I know I need to look right at that 15 mark. Because what you'll do is you'll go past the 15, you're like, oops, and then you can't push it back in. Remember that. If you get too much, guys, you have to throw it all out. Because you can't push some of the regular back into the NPH, correct? Yes? Okay, so remember, air first in the NPH, the cloudy, and then you're going to put air into the regular. So the last time you put the air in, you immediately flip that bottle, and then you draw it up. Any other questions? So the drawing is clear to cloudy as far as drawing the medication, but you can put your air into the NPH. So I don't want y'all getting that confused. Good? All right. So you went over cardiac, I went over insulin.
Do the next segment.
You want to do that another one? All right, hang on a second, because I'm just trying to think about what else. There's so many.
Yeah. There's somebody to do. I'm back. All right. So the other thing I want to say is remember your standard nursing care with all your medications such as insulin. Remember your monitoring for signs and symptoms of hypoglycemia. And students will always say, oh, they're confused. You can be confused with any medication, correct? So the one that's hallmark for hypoglycemia, remember, is cold and clammy, you need candy, all right? So just remember that when giving your insulins and your standard nursing care that you already know that they have to have a food tray available, especially if it's short or rapid acting, all right? So just go over your standard nursing care, which you already know because you've been working with insulin since level 1. All right, the next thing I want to talk about is I just want to condense everything about pain medications real quick because there are some subtleties. Whenever you're studying pain medications of any kind, all I want you to do is remember your pain scale and what we use, because we are going to organize this according to the pain scale. You know our pain scale goes 0 to 10 when we are assessing pain in our patient, correct? If I have pain 1, 2, 3, I know that's mild pain. And what will we be using for mild pain? We know we'll turn to our Tylenol or acetaminophen, correct? Our NSAID drugs and ibuprofen, correct? We'll be using. Now, remember the differences of what we're looking for. When you're talking about acetaminophen, where is acetaminophen toxic? Remember that it is hepatotoxic or toxic to the liver, which means that there's a ceiling or a maximum dose that we can give in a 24-hour period. And remember that dose that you cannot exceed in a 24-hour period is 4 grams or 4,000 milligrams in a 24-hour period. So please just remember liver. The reason why I'm pointing this out, you already know this, is because when we get in the moderate pain category, those contain acetaminophen as well, and we have to combine our moderate medications to make sure we're not exceeding that 4,000 milligrams in a 24-hour period, okay? NSAIDs and ibuprofen, where are these drugs toxic? Remember, they're toxic to the GI tract. So you're looking for signs and symptoms of any kind of GI bleeding. So the reason I say this is because what happened if Mary Jo Buttafuoco, who is your patient, has a history of PUD, and you know PUD is peptic ulcer disease. You did some of the GI lecture in level 2. She's in mild pain. What would you expect the physician to order? Meanwhile, you as the nurse know she has a history of PUD. So what you need to do with peptic ulcer disease or any GI conditions is please eliminate anything toxic to the GI. Same thing if you reverse that question and say Mary Jo Buttafuoco has a history of hepatitis C, you already know that involves the liver. So you have to get rid of any medication that's toxic to the liver. And if the physician was to say, give Tylenol, you have to say, no, I will not, okay? Please give me an alternative medication. All right, moving on to pain level 4, 5, 6-ish, we know is your moderate pain, and we're turning to your Percocet, your Vicodin, and your Norcos, correct? Remember, these medications are a combination medication. That second number that you may see is acetaminophen. So if you're given pain medications that contain acetaminophen from both categories, please make sure you add all those up so they're not exceeding your 4 grams. Now, what's your assessment before giving opioids in your moderate, such as Percocet or whatever? Please remember, there are common side effects and there's emergent side effects, and please don't mix the two up. What is the common side effect? Remember, Anyone? What am I doing here? Oh, yes, I have constipation. Thank you. So that's your common side effect, but what would your emergent side effect be? Please monitor for your emergency of respiratory depression. Now remember, in nursing school, that is anything under 12. So if the respiratory rate prior to giving this medication is 11, what are you going to do? Whenever something's wrong or abnormal, hold, stop. Okay, that is what we are doing. Next, your severe pain level. You have morphine, fentanyl, whatever it may be in this here. We know this can be given multiple routes, IV, injection. We can give it topical, rectally, PO. It covers mainly all routes. But because it is a narcotic, what are you going to do? There is common side effects and emergent side effect. Again, the common side effect, common is constipation, and then emergency we know is our respiratory depression. So please get the respiratory rate and hold anything less than 12. Okay, now we know that these medications, if delivered in a too much amount that exceeds levels, may cause respiratory depression. Is there an antidote to narcotics? Yes, there is, and it's right in the word narcotics, and you know that's Narcan or naloxone. All right, now I have a question for you. Can I combine these medications? For instance, my patient is in moderate pain and is receiving Vicodin or Percocet. Can I also have an order out of the severe category? And we know, yes, we may combine these because our motto in nursing is, and especially in nursing school, is the pain is always what the patient says it is, correct? And we're always covering for breakthrough pain, okay? Now, if you're combining medications, fine. Just make sure that you are looking for your side effects that we also talked about, constipation and respiratory depression. What we want to say is don't ever back up on the pain scale, because once their pain is out of control, we will never catch up. So my question to you is, it is time for Mary Jo's morphine, but you notice she hasn't had a bowel movement in 3 days. Is she going to be, are you going to administer the morphine if she's constipated? Remember, pain, we're always staying ahead of the pain. We can always give something for the constipation like Colace or Bisacodyl or whatever it may be. But we never stop with pain medication, because once we fall behind, we'll never catch up, okay? So just categorize your meds using this pain scale that I showed you and just say, what is different? All right, and your differences were mainly in the mild category, which one's liver toxic, which one is GI toxic. Okay, so that was just a quick review of your pain medications. Did I forget anything on the pain medications? All right, notice for mild pain or fever reducer, notice how I didn't put aspirin on this. Now you already know, let me talk about aspirin because it can be used for several things. We know aspirin, the main thing that we talk about is that it's an antiplatelet aggregator, correct? It is not an anticoagulant. It works directly on the platelets. It keeps it from the platelets sticking together. So aspirin, you have to make sure from the context of the test question, is this being used prophylactically for a cardiac condition or stroke condition? Hopefully it's not hemorrhagic stroke. But is it being used prophylactically, or is it used as a fever reducer or whatever? Okay, so make sure you know how it is being used by the context of that question, because it's used for several different things is really what I'm trying to say. Again, because it's working directly on platelets, keeping them from sticking together, that you will be at risk for bleeding. But there is a toxic sign and symptom of aspirin toxicity that I want you to be aware of. And you know that is tinnitus or ringing in the air. So please monitor when your patient is on aspirin for ringing in the air. Now, when you start pediatrics and OB, you'll be talking about how aspirin puts a child more at risk for Reye's syndrome. I don't care right now. You're going to do that in PD, okay? So just put this in context of, am I using this prophylactically for a cardiac condition, or am I using it as a fever reducer, antipyretic, or am I using it for a mild pain control? Okay, thank you. What are you doing there?
I don't know. I'm still on the aspirin. Okay. No, that's okay because I'm good. Something else on the aspirin, guys. What do you want to make sure that you're teaching your patient about with aspirin, or really any anticoagulants? What do you want to make sure that you're teaching them? Okay. Assess for bleeding. What do you mean by assess for bleeding? What are you going to tell them? You're just going to look at your patient and say assess for bleeding? What are you going to tell them? Assess for bleeding where? Gums. Where else? Nose, stool, okay, urine. Don't forget the urine as well if they notice anything. Be careful shading. Yeah, they don't have to, for aspirin, guys, they can use a razor, right? We'll say anticoagulant, which one would you want to teach them maybe not to use a regular razor? Okay, Coumadin, definitely with Coumadin. Okay, I'm not sure, Brandon, on the Xarelto. I mean, they need to be very careful with that. So yeah, so we're going to talk. I'm going to kind of briefly go over the Coumadin with you in just a second. What else with antiplatelets or anticoagulants do you want to teach them? That maybe when they're at home, like they're going to be discharged, and I'm really kind of been stressed. I mean, I think a lot of faculty have been doing more of this because of the whole COVID. I don't know if y'all have, but I know we have. What do you think that is? Drinking. Thank you. Alex, that's so true. I just say, guys, that's so true. So yeah, so you're gonna have to make sure that with aspirin or any antiplatelet, any anticoagulant, guys, they're not supposed to really be drinking alcohol, okay? Because the alcohol can make it even thinner. So let's go back to the Coumadin just real quick. All right. So somebody who's going to be on Coumadin, what are you as a nurse going to assess for? Anyone? What are you going to assess for Coumadin? Bruising, that's fine. But okay, thank you, Nakaya. INR, okay? Now they'll do a PT and an INR. I don't really care so much about the PT. The PT is going to be way off. I mean, I already know that. That's fine. It is the INR because I got to make sure it's in a therapeutic level, okay? So like with Xarelto, Eliquis and stuff like that, they're not going to draw labs. Remember that. So if you're not going to draw labs, what are you going to assess for then? Let's say it's the Xarelto, the Eliquis, all the new ones that they're using for AFib. What else can you assess for? Because they don't do a PT-INR. Okay, bleeding, but what else can you at least look at? What are you going to be looking at, guys? Okay, thank you. Brandon says hemoglobin. What else besides H&H? Platelets. Thank you, Samantha. So definitely, I don't have something that we don't worry about those anticoagulants being in a therapeutic range because they don't really do that, okay? But it doesn't mean I go, oh, I'm not going to look at anything. I'm going to still look at platelets. I'm going to still look at hemoglobin and hematocrit, just like I would with Lovenox, right? Remember that. Because I have to see, why is my patient on it? Is it because they have AFib? Are they given it because they've had blood clots? I don't know. All right. Going back to the Coumadin, yes, I'm going to check their PT and INR, right? Let's see. What else? There's something else on the Coumadin I was going to do. Oh, what's the antidote for Coumadin? All right, vitamin K. And that is the only anticoagulant that has an antidote. Just remember that. So just in case. All right. All right, so he touched on that one. I got the Coumadin, talked about that. All right, let's talk about vancomycin for just a minute.
Ooh.
Okay? All right, so what is vancomycin? And we can say the Vanco and we can say the gentamicin, that's fine, but we see Vanco used more often. What is that? It's an anti-infective. Okay, before I give this, what am I going to be assessing for? Okay, white blood cells. That's good. I definitely want to see about my white blood cells because why am I looking at white blood cells? Because that's going to tell me if it's what? If it's working. Absolutely. Okay, Brandon, you said renal. Well, what do you mean by renal, Brandon? I don't know what you're talking about. Oh, look at that, Rebecca and y'all. Okay, I definitely want to look at my BUN and my creatinine. Why am I looking? Why do I care about it for Vanco, but I don't really care about it for Ansef and all those other ones? Oh, look at that, Stephanie. You said nephrotoxicity. Okay, so what is a sign that a patient would have if they become nephrotoxic? What are you going to be looking for with your patient? Okay, decrease in urine. I don't know about that. Maybe, but not necessarily. But I'm talking about specifically with vancomycin. Okay, spike in the creatinine, sure, but still, what else? You're going to see it on your patient. Not edema. Okay, so it's going to affect what organ again, did we say? The kidneys. So we're going to be seeing something with what did the kidneys produce? The urine. All right, so what are we going to see in their urine, guys? There's going to be something specific that we're going to see. Cloudy and pink. Okay, so that's something. No, we're not looking at the proteins, guys. I'm talking about when I say you're going to see it, you're physically going to see it on the patient. If somebody is on vancomycin, okay, let's say you don't even have their lab levels back because, it's been taken all day long. You're going to look at their urine. If it's cloudy or it's pink color, that is a sign of nephrotoxicity. Okay? Are we good? I wanted to make sure I went over this Vanco with you guys because that's one that's really hard, especially with the kidneys. And the last thing we want to do as nurses is put our patient into kidney failure. We put them into kidney failure, then you're going to see all those areas or the problems with maybe like a decrease in urine output or maybe some swelling, but that's going to come a little bit later, okay? So make sure that you're looking for that. So I definitely want to look at white blood cell count. I'm going to do that with every antibiotic, correct? And then what else besides white blood cell count, guys? What if I don't have my labs back? What else can I look at for any kind of antibiotics? Temperature, yes, I absolutely want to look at their temperature. Because again, sometimes you just don't have those labs back, all right? So I'm gonna see if they're having a fever or anything. Because if they've been on this for a couple of days and all of a sudden their temperature is spiking or their white blood cells are spiking, what does that tell you as a nurse? It tells you one or two things. It's either not working, you're right, Stephanie, or what else could it be telling you? Not working or sepsis, yeah. Okay, or they could have another, thank you, Michaela, another super infection. Absolutely, okay? It's not our job to know that. Our job is just to say, oh my gosh, they have their white blood cell went from 11 to 16. They've been on Vanco or whatever they've been on for like 4 days. It's just my job to notice that and make a phone call and tell the doctor and say, hey, I don't know if maybe it's not working. I don't know if, Stephanie, you said a dosage maybe, okay? Or I don't know if they've got another infection somewhere. So maybe I want to look somewhere else. Maybe I want to look at their urine. Maybe they were on it because of pneumonia, but now they've got a UTI. You've got to gather all this information the best you can. So when you give all of that, when you're doing your SBAR and you're giving it to your healthcare provider, that lets them make the best decision possible. Okay, if you want to guess and say, hey, look, I know they're on it for pneumonia, but man, their urine stinks and it is cloudy, and then I think they might have a UTI. Do you want me to get like a urine sample and send it down? You can always ask for what you want, guys. Always ask for what you want, okay? Dilantin. What is Dilantin? Let's talk about some anticonvulsants. Anyone? Well, I already said it's an anticonvulsant. I just gave it away on that one, okay? What is it? What are you going to assess for with Dilantin if a patient's on it for seizures? Because y'all are going to be this week you're going to be watching my big grid lecture on the neuro part 2, which includes seizures. Okay, so yeah, seizure activity, but what are you going to be If I'm going to give my patient Dilantin, what are some things I need to be doing as a nurse? Yeah, I want to assess if they're having any seizures. That's great. Neuro checks. No. Okay, my patient's not having a seizure, guys. If I'm going to give them Dilantin, okay, Brian has a history of seizures. He's not having one, but I'm going to give him some Dilantin. What would I like to assess for prior to giving Dilantin? The last time the seizure happened? Okay, that's fine. I'm going specifically on Dilantin. Well, I want to see first if we even have a Dilantin level. Sometimes they'll do that. Depends on where you are. In acute care, guys, okay, Bridget, hold on to that one. In acute care, I'm going to probably looking for a level. In rehabs, guys, they really don't do it. Okay, but I'm still want to be looking for a level. All right, so Bridget, you said oral care. Oh my gosh, yes, you have got to be looking at their gums. One of the biggest side effects of Dilantin is called gingivital hyperplasia. And if you ever look at a picture of it, and you'll see it in my video, it looks like somebody just got their gums and just like made them all big and inflamed, and it's really bad. So you're going to have to tell them, a patient who's on Dilantin, you're going to have to tell them to use like a, yes, Brittany, I love oral care, a really soft toothbrush, okay, because they have to be very, very careful when they're on that Dilantin. So you've got to look at their mouth, guys, whenever they're on Dilantin. That's a big one right there. Let's see. Prednisone, what is prednisone? We know what that is, right? But what is, I mean, it's what? Okay, it's a steroid. Why would somebody be on prednisone? Can you be on it long-term and short-term? Yeah, you sure can. I don't even know if I just spelled that right. I don't care. Prednisone. Okay. Yeah, so you can be on it long-term and short-term. So some anti-inflammatories. Like what? Okay, what did you say? Oh, what is the level for Dilantin? We're not going to ask you that question. I have a level down. I don't remember what it is right offhand, but we won't ask you that as far as on an exam, okay? But yeah, I would say just check the level. Anti-inflammatory, but why would somebody be on prednisone? Like, give me an example of why somebody would be on prednisone. Okay, COPD. Okay, they could be on it for that. They could be on it for asthma. Okay. Okay. What are some things about prednisone you're going to teach your patient? That what is prednisone going to increase? Or what could it increase? Could. Okay, maybe some weight. Okay, but blood sugar. Okay, so it can increase their blood sugar, especially if they're diabetic, right? Mm-hmm. And what can it decrease? They're immune, okay? So we're going to say, I'll just say WBCs. All right, so what do you want to do some teaching with them about this? Okay, so if they're diabetic, you want to say, hey, you might want to really make sure you're watching your blood sugar, because when you're on the prednisone, it can make it go up, so you may have to adjust your insulin, okay? If it's for white blood cell count, if they're going to go home, what are you going to teach them? Hand hygiene, what else? If they're at risk for getting sick, it's not just hand hygiene, okay? No neutropenic precautions. They're not even that far yet, guys. They're not even way down like that. If I'm going to go home on prednisone and my doctor tells me you're going to be on this for, like a couple of weeks, and I know that it can lower my immune system, what do you want to make sure that you're telling your patient? Okay, don't be around a lot of people. Absolutely. This whole COVID thing, right? So you're going to not be around a lot of people. I want to be in crowds. Let's say COVID wasn't even happening. What do I want to notify my doctor about? Okay, check your temperature. Notify them if what? If I get a fever, what else? Okay, chills. So anything that's showing that my immune system is like going down, and maybe I was around somebody who had a cold or somebody who had a flu or Lord forbid COVID. So I want to make sure that I notify my physician and saying, hey, I feel like I'm getting a temperature. I don't know if it's because of the COVID. I don't know if it's because I'm on prednisone, but I need to make sure that I'm notifying my doctor about that, right? All right. What if they get a sore throat? Could that be something that says that maybe they're getting sick? Okay. So anything with sickness, guys, it's not just a fever, it's not just chills, sore throat, anything like that. Okay. Went over that, prednisone. Oh, long-term prednisone. When somebody's on it for a long time, guys, what does that put that patient at risk for? Does anybody? Well, it does a couple of things, but anybody? Okay, thank you, Stephanie. Bone loss. Their bones get really brittle. Bone brittle is what I'm going to say. So what does that put them at risk for if their bones become really brittle? Okay, osteoporosis and what else? Fractures. Thank you, Cynthia. Okay, so sometimes you will see patients who are on prednisone, even with males, they will give them a calcium supplement. Okay, because they are at risk for bone brittle. So when they're on prednisone for a long period of time, I'm not talking for a couple of weeks, guys. It's like just going to have to stay on it. All right. So make sure you're watching, because if they're going to get up and if they were to fall, they have a tendency to have a fracture more than somebody who's not on prednisone. Make sense? Let's see. I think y'all know. I mean, y'all know Lasix. I mean, you like Lasix? You want to talk about Lasix? And I'll talk to him. All right, we're gonna let Brian, because he's like all excited about Lasix now.
Did you say taper on the steroid?
Oh no, huh? Yeah, there's like
Just one thing on the prednisone. Remember, because while you're on prednisone, the adrenal glands are shut off, that you can't take that medication away quickly and expect the adrenals to kick back on. You have to do it slowly over time. So what I'm trying to say is don't discontinue abruptly for all your corticosteroids. Please taper down. All right, moving on. You already know your diuretic, so I don't want to spend a lot of time on it, but you know you have your thiazide and loop diuretics. You know we have Lasix, we have hydrochlorothiazide. All right, are your two main medications here. However, I want to call your attention because students usually get confused when it comes to Lasix and hydrochlorothiazide. Yes, they're both diuretics, but do we give Lasix as the first line of defense for the treatment of hypertension? No. Remember, when it comes to Lasix, that we were using Lasix for generalized edema, especially in the extremities. But remember, the edema we talked about in level 2 was preload, which means fluid, correct? With heart failure. So we're talking about fluid edema when we're talking about Lasix. Hydrochlorothiazide, on the other hand, was your medication of choice for hypertension. There's the difference. But what's the same among all of them, that you should know this by now, is that you must monitor the potassium level before giving any kind of loop or thiazide diuretic. Okay? Again, in nursing school, if the potassium level is 3.4, that is out of range. So what are you going to do? Stop, hold. All right? And then students will say, give them a banana. Well, I'm going to have to eat 16 bananas to get my potassium up, so please get an order for a potassium supplement and hold your loop diuretic. Now, my question to you is, remember your nursing care with your loop diuretics or thiazide diuretics. Why do they call it Lasix? Hello? That's correct. Oh, Jessica, you're the best, because it lasts 6 hours, which means I'm going to be diuresing or peeing for 6 hours. So that means, as a nurse, when do I want to administer this? Well, if it's just PO and they don't have a catheter, of course I want to give it in the morning, because I don't want them up for 6 hours during the night, getting up without a night light, tripping over their scatter rug and hitting their head on the sink. All right? So please, in the morning. But of course, if they have heart failure, they're most likely in an emergency. It doesn't matter what time we give it if we have a Foley catheter, correct? So just remember your standard nursing care. Now, you know your one diuretic that's different than all the others, you know, will be aldactone, also known as spironolactone. This is, you know, is potassium sparing. So if I'm not getting rid of potassium, what am I at risk for? I'm at risk for hyperkalemia or potassium greater than 5. So please monitor the potassium level. It requires reverse thinking because we have low potassium and then we have one that is retaining potassium. So please keep that straight in your mind. What's the same among all of them? Remember, we're not only following potassium, but we are monitoring I and O. Remember with your renal lecture, weight was a great indicator of fluid volume in the human body. And we need BUN and creatinine levels because that will, if we are renal impaired, that will also interfere with potassium as well. All right, so that's your basic diuretic outline. All right.
I think we're good with meds.
Are we good with
I
meds?
think so.
Any questions about meds? There's just one other thing that I want to dispel real quickly where I see the most error on examinations is the upper GI medications, just real quick, okay? Please pay attention to the wording. So let me give you the trick. When it comes to your upper GI meds, you have medications that neutralize, you have medications that reduce hydrochloric acid, and you have medications that inhibit or stop, okay? So if we're talking about neutralizing in the question, you know those are your Tums and your Rolaids medications that help neutralize. To reduce the amount of hydrochloric acid, we turn to our A2 blockers such as famotidine or Pepsid. That's reducing. Now, they're finding, you may have seen that, I forget the one that just got pulled off the market, but if we're reducing and not allowing, we're shutting off those parietal cells in the stomach, they say that you're more at risk for gastric cancer over time. So you shouldn't be on these more than 2 weeks. And in fact, you're behind a lockbox in the CVS or Walgreens, whatever store you prefer, okay? But that's reducing. However, we have one that completely shuts the pump off and does not release hydrochloric acid. It inhibits, and we know that's your protonics. And it's right in the word. It shuts off the proton that's creating hydrochloric acid. So read your question carefully. We're either neutralizing, reducing, or inhibiting, or stopping. Well, that's how you keep that straight, okay? Also, since I'm in the upper GI, I moved down to my lower GI. I haven't had a stool in 3 days. It's the size of a Volkswagen, and I can't push it out of my rectum. So I'm going to bear down, have Valsalva maneuver, faint, and fall off the toilet. All right, so what we want to do, of course, is whenever we're turning Colace softened stool, whether we're using Bisocodyl suppositories, we are drawing fluid into that stool to make it soft so they can pass it. So please encourage fluid, encourage fluid, encourage fluid, because that fluid is being drawn into the stool. Well, where's the fluid in the rest of the body that the body needs for cellular life? So please encourage fluid when doing anything with lower GI, and that sums that up. Fluid, 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 lower GI done.
They had a question on it. It says that what are the 2 meds for the H2 blockers?
I don't know what's on your list. I know famotidine is.
Let's see.
I know famotidine, Pepsid's on it, and I don't, is it Tagamet the other one? I don't know. Famotidine is the only one I have on the list.
It's just Pepsid and Protonics.
Pepsid.
Well, that's for the H2.
H2 is your Pepsid,
and the Protonics.
and then the Protonics is your only one for the PPI.
Yeah.
So remember reduce, and we have one that stops. All right. Oh, that was fun.
There we go.
All right. Do you have any questions? I think we'll take a short break before we do the math portion.
So how about 5 minutes? Because it's
5 minutes?
It's a little after 9, so we get done.
It's a little after 9, so we'll be done before 10. So what time is it now, Stacy?
9:08.
9:08, so 5 minutes. We want you back at
9:14.
9:14-ish.
Yeah.
Okay.
9:15 now. How about that?
All right, so get yourself your dry erase board or a piece of paper, and we'll do math next. All right, so see you in 5 minutes.
Turn the thing on. Just voice. Okay, let's go ahead and get started, guys. All right, real quick, what I'm going to do is I want to just go over these roundings and all that fun stuff because this is another area that I see you guys like make a simple mistake on. Okay, what's the song that I would have you guys sing when it says drops per minute, mLs per hour? Come on, y'all remember that song? Okay, I'm not talking to you, Bella. I want a whole number. Thank you. So, guys, this is whenever you're on this, okay? So if it's an IV, remember that. So if I'm doing an IV calculation, drops per minute, mLs per hour, I want a whole number. So I want a whole number. If my answer comes out to be 126.14 on my calculator, what's my answer? 126. That's it, guys. If it comes out to be 17.81, what's my answer? Okay, it's 18. This is the only time, drops per minute and mLs per hour, we're going to look at the tenths. That's the only time you're going to look at the tenths. So yes, my answer is 18. All right, we're done with IV. Now we're going to just mLs, which means I'm going to have a syringe. I'm going to draw up my medication in a syringe for mLs only. mLs only, we're going to look at the what? Which ones are we going to look at? Tenths, hundredths, or thousandths? No, we do not look at the tenths. We only look at the tenths when it's with the IV. This is we're going to draw up. I'm going to drop Solumedrol. Okay, we're going to look at the hundredths. Tenths, hundredths. Okay, remember when you're drawing up just mLs in a syringe, we're looking at our hundredths. Now remember, do y'all remember this from before? Here's our hundredths. We got to look at his best friend that's to the right of him. Is that correct? Okay, so then we look at that. Does this best friend to the right, does that affect you or your, okay, sorry. This is me, this is Brian, okay? So I'm gonna look at my thousands, so you're gonna round to the nearest hundredths. So what's my answer gonna be? Does Brian affect me, yes or no? No, he does not. My answer is 0.91, okay? So now I'm gonna come over here. Here's me again. There's tenths, there's hundredths. Now I'm going to look at my friend Yolanda to the side of me. Does Yolanda affect me? Yes, she always affects me. I tell you, that's Yolanda for you. All right, so you've got this 9. This 9 is going to turn this 9. So she's a 9, I'm a 9. It's going to turn me into a what now? Into a 10, but then I have to carry that over, right? So then that's now going to change this other person, and what's that going to change that into? A 9, right? So then my answer is going to be what? 1.9, 1.9, okay? This one is a little tricky because see how all of us kind of affect each other? All right, so I want to make sure that everybody's got this. I want to erase this so that way if y'all need to write it down. Okay, so you're going to look at this. All right, let's come over here. Let's look at me again. I'm an 8. That's my hundredths, okay? Now I'm over here, and I've got my friend Jennifer by me. Does that affect me? Is Jennifer going to affect me or no? Yes, she is. All right, so this 9 is going to turn this 8 into a 9, correct? What is my answer? Okay, my answer is 2.99. That's it. That's it. Don't keep carrying over. It doesn't need to carry over. All right, well, what about this one? What's the answer to this last one? 0.45. What's the answer? That's it, just 0.45. What I don't want you guys to do is if you come up with an answer and you only have your tenths and your hundredths, don't be looking up here to the side. There's nobody there. So if I have nobody there, nobody gets affected. That's it. Okay, is everybody good on this rounding? I'm going to give you one more just for fun. Somebody give me the answer to this one.
Oh, my.
Okay. All right. Yes, y'all are all right. It is a 2. Because remember, here I am. I go look at my friend over here. Today, my friend is going to be Mary. All right. Is she going to affect me? Yes, she's going to make me into a 10. And then that's going to have to carry over. Only when this 9 turns to a 10, it carries over. Oh, look at that. And then that carries over. Oh, there you go. And then the answer is just 2. Not 2.0. You will get it wrong. It's just 2. And if you have a decimal, if the answer comes out to be 0.45, remember to put the 0 point something, 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 whatever you have to say. Are we good on calculation as far as like our rounding? Take your time, guys, on this test with that. I don't want y'all to rush it. Just per minute, mLs per hour, I want a whole number. I will look at my tenths only then. That's the only time I'm going to look at my tenths. If I'm drawing it up in a syringe and I'm drawing it up, I'm going to look at my hundreds. We're rounding to the nearest hundreds. I'm the hundreds. Who's my friend? Are they going to affect me, yes or no? If they don't affect me, I drop them. So see, Brian didn't affect me, so I dropped him. Got it? Are we good? All right. We're going to let Brian take over as far as on that paper that he sent you guys or whatever y'all went over. And that way y'all get that done. There you go.
Great, thanks. Okay, so the next thing we want to turn our attention to is we'll actually get into solving some problems just so you can see the setup. But what we want to do is keep this extremely easy. And that being said, before we get into any type of dosage calculation solving, is we just want to keep a couple calculation conversions in the back of our head. If you're ever lost in any kind of math problem, I always want you to remember 1,000, because when we're going to be converting from milligrams to micrograms, from micrograms to grams, whatever, we're always turning to the rule of 1,000. And you will see in one moment that 1,000 always goes with the smallest unit of measure. For instance, microgram is smaller than milligram, so the 1,000 will go with the smallest number, which is micro. But you'll see that when we set up the problem. The other thing that I want you to be aware of is the number of 60, because this covers a couple areas that you need to be aware of. The very first one is I don't want you to get confused on an exam. For instance, you will see a lot of G or GM used. We know that stands for gram, correct? And students sometimes will misread GR and consider that a gram, and it is not. That is a grain, correct? So please be careful with your G's. So read it slowly. If we're talking about grains, it is 1 grain equals 60 milligrams, okay? So don't get confused between your G, GM, and GR, first of all. All right, the next thing is I want you to keep in the mind of 60 is when we get the problems and we have to solve drops per minute. You know there are 2 types of tubing. There is micro drip tubing and there is macro drip tubing. Now, macro drip, meaning that it is a larger drop, comes in 10 drops per milliliter, 15, and 20, which means there's several different types. So on a test, they have to give you the drop factor for a macro drip tubing. However, there is micro drip, and there's only 1 micro drip. And again, when in doubt, choose 60, because micro drip is 60 drops per milliliter. And they don't have to tell you that. They can say, the nurse is using micro drip tubing. And you have to know, oh, micro simply means 60 drops per milliliter, okay? So we're using 1,000 for several things, and we're using 60 for 2 things. So if you can remember those 2 numbers, we've conquered half of this. All right, moving on. Because you're going to be farting around with children during this semester, you know that things are going to be dosed according to teaspoon and tablespoon, correct? Please remember our teaspoon, our little spoon. We know 1 teaspoon is equal to 5 mLs. And then we know there are 3 teaspoons and 1 tablespoon. So we know that's going to be 15 mLs. All right. This is important more than ever because, like I said, you're going to be dealing with the pediatric population. So whenever a test question says, oh, there's 25 milligrams per teaspoon, just take that teaspoon out and throw in the 5 milliliters. All right. All right. Anything else? Remember, if you're dealing with ounces, remember 1 ounce is 30 milliliters. And these are the major ones that you want to remember. All right, and we'll do those with the problems that I sent you. Now, the problems that I sent you, we're not going to do all of them, but we're going to do an example of each one, and we can see how it progresses over time. So please remember those numbers to your right. The nice thing is this isn't level 1 anymore, which means that you should have a drop-down calculator. But please remember, calculators and technology is only as accurate as the person running it, which means you really have to pay attention to the numbers that you're entering into that calculator. Because just because you have a calculator, you don't want to hit the wrong button, then the whole thing is wrong. So please just slow down, pay attention to what you're doing. All right, for all standard calculation problems, you already know the rule. And the rule is always dose over hands. But I want you to remember the D stands for doctor, and the doctor is always on top. Okay? And you can interpret that however way you want. All right, so the doctor, whatever the doctor ordered will be on top, and then whatever is on hand needs to be your denominator or your bottom number. On hand is what's in the med cart, on the cabinet, on the floor, in the sky, wherever it's located. So please just make sure the doctor is on top at all times. All right, that being said, have you seen the eraser? Oh, never mind, found it. All right, so our first problem on that paper, for those of you who don't have the paper, I'm just going to read it and you're going to have to follow along. It says the doctor orders 750,000 units of penicillin IM. On hand is penicillin 300,000 units per ml. How many mLs will you give? So remember the rule. We're going to start with the doctor is always on top. And what did the doctor order? We know the doctor has ordered 750,000 what? Please get your units of measure and include that in setting up the problem so we can cancel it out later. So we have 750,000 units that the physician has ordered, correct? And what is available? And we know in the med cart, wherever it's located, we have 300,000 units per ml. And whenever you say the word per, that means that it is opposite, okay? So do not put it on the same line. Now listen, I don't care how you set up your problem as long as you get the answer right. But ACC has adopted dimensional analysis, and that's the way we're showing it, okay? So I don't care. If you do ratio and proportion, do that. If you do solve for x with algebra equation, do that. But this is the easiest way, okay? The nice thing is that you will have a calculator now. So look at all those zeros. Please make sure that you're entering the appropriate amount of zeros. However, I don't have a calculator on me, so I'm just going to show you that whenever there are zeros on top of each other, they must be on top of each other, not next to each other. If they're on top of each other, we can just line them out and cancel them out, correct? So what I'm left with is 75 over 30 after I cancel out those zeros. All right. Now, also, why I made you put the units of measure is because those cancel out too. And what am I left with? I'm left with the lonely ML, which the problem asked for, correct? All right, so that is how I get to 75 over 30. And the nice thing, you have a calculator, but you have to enter it in the calculator, right? So what I want to say, when you are dividing, the numerator always goes inside the house, correct? So you will enter what goes inside the house first in your calculator. So what this is saying is 75 divided by 30. And how many times does 30 go into 75? You know that's going to be 2 times, correct? 2 times 30 is 60. 75 minus 60 is 15, right? And does 30 go into 15? No. So you are stopped. You have come to a stop sign and you look both ways, no one's there. 0 for no one is there at the stop sign. And 30 into 150 goes how many times? It will go 5 times, okay? Now the nice thing is, like I said, you have the dropped calculator. So just please make sure that you did 75 in the calculator first, divided by 30. Now notice I have 2.5, but Stacy just went over the rounding rules, correct? And you, for some reason, you're nervous during your test and you say, I have to go to the hundredths. Do not add a 0. Leave it alone, okay? All right, so that was your standard problem. Now let's do one where we actually have to convert. And I'm skipping down to, all right, number 2. All right, so number 2 says hydrodiaryl 0.05 grams is ordered. On hand is hydrodiaryl 50 milligrams per tablet. How many tablets will you give? So the very first thing, remember, the doctor is on top. How much did the doctor order? And we have 0.05 grams. That's not grains, that is grams, okay? And then how much is available or on hand? And we know what's available is 50 milligrams. Now that is why I always tell you to write your units down with those numbers so you can see that it does not match, correct? So we have to convert. In order to cancel each other, they have to be on top of each other. So we know grams will be in the bottom and milligrams will go to the top. So we can cancel them out later, okay? Now remember, you say, oh, now I have to convert. Well, I already told you, whenever it comes to conversion, it's always the rule of 1,000. But remember what I said. All you have to remember is 1,000. But 1,000 always goes with the smallest unit of measure. So is it 1,000 milligrams in a gram or 1,000 grams in 1 milligram? Which one is it? If the 1,000 goes always with the smallest unit of measure. Is a milligram smaller than a gram or is it smaller than a milligram? Hello? All right. So we know milligram is smaller, so it's going to be 1,000 milligrams per 1 gram. And now look, I can cross out my units of measure because they're on top of each other, and I'm left with tablets, which I'm solving for, correct? All right, so the nice thing is I have a calculator, but I'm going to do it the long way so you can see what your calculator is doing. We're going to multiply across 0.05 times 1,000. And if you say, oh my God, I can't do that. If you didn't have a calculator, but you do, so good for you, all right? All I have to say is when I'm multiplying, how many zeros exist in 1,000? And there's 3, correct? So whenever I multiply, I can move how many spaces there are for zeros. 1, 2, 3. Leaves me with 50. Did you see how I did that? 1, 2, 3. Good, done. You won't have to do that because you have a calculator. All right? And 50 times 1 is 50. the top number goes inside your house or entered first in the calculator. So 50 divided by 50 is what? 1. So all you remember with that problem is please just put your 1,000 with the smallest unit of measure at all times when converting. And all we're doing there is keeping it simple. Oh, that's fun. All right, now this next problem irritates me because if you get one wrong, it's always this one. So skip ahead down to number 5, okay? Streptomycin 0.5 grams IM is ordered, sorry, my Northeast accent. Available is 5-gram vial of streptomycin. Directions on the vial are to reconstitute with 6.5 milliliters of sterile water. The resultant solution yields 500 milligrams per 1 ml. How many mLs would administer? Now listen, you get all bothered with this problem is because you were required to mix something. Well, I don't care if you mixed it with your tears, urine, or stool. It has nothing to do with anything to do with this problem because I already told you it is always doctor over what you have available on hand. There's no M in this equation for mix, okay? So what did the doctor order? And what I'm looking for in these reconstitution problems is what has resulted after I mixed it. So you're always taking the number that follows results in or yields, all right? I always want the number after it's mixed. I don't care how much and what you mixed it with when it comes to math. So that's all there to distract you. I want the number after it was mixed, and that's what I have on available. So that being said, what did the doctor order? Because we know the doctor has always on top, correct? And the doctor ordered 0.5 grams, okay? And what is available? Remember, I don't care what I mixed and with what at this point. I want what it resulted, yielded, or the total after mixing it. And what I have available is 500 milligrams per 1 ml, okay? So look at my problem here. Remember I told you have to write down your units of measure because you notice immediately they do not match. So it requires conversion. All right? So remember they have to go opposite each other to cancel out. And that means milligrams would be on top and grams would be on the bottom. Remember, if you don't remember to convert because you're nervous, all you have to do is remember one number, and that number is 1,000 always conversion, and that number always goes with the smallest unit of measure, and it's the same as the last one, milligrams smaller than grams. So our 1,000 per 1 gram. Okay, now you can enter this in your calculator, which works out nice, but I know when I'm multiplying across, I have 3 zeros there, so I can move the decimal 3 places. 1, 2, 3, and that left me with 500, correct? And then 500 times nothing else is there, so I have 500 over 500, all right? You can cross those zeros out if you want, but you'll have a calculator, so it doesn't matter at this point. And all this is saying is 500 divided by 500 or 5 divided by 5. And your answer will equal 1. Remember what Stacy said with your rounding rule, there's nothing to round, leave it alone. Okay? So please don't be fooled by mixing stuff. I want the number that exists after it was mixed. Okay? All right. Oh, that was fun. Wasn't that easy? All right. Moving on, let's hit IVs. All right. And IVs start on page 2. But before I start IV problems, I just want to give you some basic formulas so you know what numbers should be on top and what numbers should be on bottom. Because I don't care the way you set it up as long as you have it in the right area. So let's start with drops per minute, okay? What you're going to need in the top is we're going to need your amount to be infused, which means how many milliliters are in your IV bag. So here's a bag of Stacy's morning urine. All right. How much is in this bag? That number is always going to be up top. All right. And then what else needs to be up top is your drip factor, which means what kind of tubing are you using? And that's always measured as drips per milliliter. Okay? These need to be up top. If they're not up top, you've set the problem wrong, which means there's only one thing left that must appear in the bottom. And you know that's going to be time. And what's the time interval we're solving for? That bottom number is always going to have to be time in minutes. Okay? So if you have time up top, it's wrong. If you have any other thing from the top and the bottom, the problem is set up wrong. So I just want to call your attention to what should be up top, what should be on bottom. All right? Next, we have milliliters per hour. Well, for milliliters per hour, the only difference is we don't have a drop factor, and we are solving for time, but the time must be an hour at the bottom. So it's the same problem, except hour and time is on the bottom, and we don't use a drip factor. So sometimes they give you a problem and they include the drip factor and they want you to solve milliliters per hour and you plug a drip factor. No, okay, it's there to distract you. So please just read carefully. So hopefully you got those down. So as I set up the problem, you know what goes on top and what goes on bottom. So the very first one that we want to do is, let's just start very basic and go with number 1. All right. So number 1 says the total volume to be given is 240 milliliters. That is your IV bag that I held up for you. And the time over which this is to be given is 12 hours. Oh no, it's hours and I have to solve for minutes, all right? The drop factor is 60 drops per milliliter. How many drops per minute will be delivered? We are solving drops per minute. All right, so remember our top number we need to start off with is how much fluid is in that bag or the amount to be infused. And I know that is 240 milliliters, okay? Up top also needs your drip factor. And look, drip is up top if I set up my problem here. Our drip factor is how much? 60 drops per milliliter. Whenever you see the word per, it's opposite, remember, okay? But what's left at the bottom when I gave you that formula? What do I have to make sure is there? And remember, time always goes on the bottom. And in this problem, the time was 12 hours, correct? But if you look across, that is not what I'm solving for. So I need to convert that, and just like all our other problems, to convert, we need to go across so we can cancel. So we're going to have hours over minutes, correct? So 1 hour equals 60 minutes. So I can get rid of my hours, and I can get rid of milliliters, and what I'm left with is drips over minute. And isn't that what I'm solving for? Oh, this is fun. All right, now you'll have a calculator. All right. Now, if I didn't have a calculator, are there any zeros on top of each other? Yes, so I could get rid of those, but that's completely up to you. Just make sure you enter it into your calculator correctly, okay? So what I want to say is 240 times 60, correct, is how much? Anyone? I have 14,400, all right? And I have 12 times 60, correct? Which is how much? 720 is what I have, all right? Now to make this more manageable, I could cross out a 0, but however you have a calculator, like I keep repeating ad nauseum, all right? So I can do 14,400 divided by 720. Remember, the top number gets entered into your calculator first. And once I divide that, how much is left? What do you get for a number?
20.
Exactly. So remember, after I divide, I end up with 20. Remember the rounding rules, because we are doing IVs. There's no such thing when I look inside this jerk chamber, there's no such thing as a partial drop. I can't count a decimal inside this, and I don't know how you can either. You can't, okay? So that's why we always say it's either a drip inside this or it's not. So it has to be a whole number. Well, lucky for you, when you did this math, it ended without a decimal at all. So you do nothing with it because it's already in whole number form. Okay? Now, the thing I want to call your attention to is, remember I told you earlier with the tubing it says 60 drops per milliliter? They didn't have to give that to you. They could have said the nurse is using micro drip tubing. And there's only one micro drip tubing, and you have to remember to plug in 60 whenever you see micro drip tubing if they don't give you a number. For all the others, 15, 10, 15, or 20 drops, they have to tell you in the problem because there's multiple types of macro, but they don't. All they have to say is micro, and you know, plug in 60. Okay? Does anyone have any questions there? All right, so what I want to do is see real quick if there's any kind of distracting question. Oh, here's a good one. All right, the last one, number 5. Number 5 says we want to solve milliliters per hour. And it says the doctor order says 100 milliliters of ceftriaxone sodium, 1 gram to infuse over 30 minutes. What is the hourly rate? Now, if you remember the formula that I gave you, what should be up top and what should be on bottom, we know the amount to be infused, or the IV bag itself, is 100 milliliters. That's going to go up top. And on the bottom, as you see, is always time. And our time here is 30 minutes. All right. However, you can see I'm not solving for minutes. I need this in an hour, correct? So it's the same thing as we've always been doing. We have to go opposite to cancel out. And I'm going to say there are 60 minutes and 1 hour, okay? Now, some of you know already when you're using the pump, you just double that. Who cares? Just write it out so you know that you're getting it right, all right? So minutes cancel out, and what I'm left with is milliliter over hour, and that's what I'm solving for to begin with. Now, listen to me carefully before I continue. You saw in that problem it says there's 1 gram in this bag. I don't care, because when I'm talking about IVs, it has to be mixed, and it's already mixed and is already in this fluid. So where in that formula do you see dry weight of powder of medicine that I mixed in this bag? IV means fluid. So ignore it. Ignore solids in this instance, okay? Because it's not even in the formula. All right, now I can get rid of a 0 here. 100 times 60, all right? Or 100 times 6, whatever you want it to be. I'm just going to keep the 60 and say 6,000. 30 times whatever is 30, correct? So you can get rid of a 0 or keep it like that and make sure you enter it correctly into your calculator. And 6,000 divided by 30 is 200. And again, with this math problem, is you landed with a whole number IVs. There's no such thing as a partial drop, so you're going to leave this alone. But just for all intents and purposes of doing this, what happened if you had 200.34? All right, remember what Stacy told you about your rounding? This is an IV, so I do need a whole number. So I go next door to see who's there. It is less than 5, so we're going to leave this alone. Keep it at 200. If this was greater than 5, like 200.64, then this would be 201. Okay? Remember, the biggest mistake is silliness, which is you forgot to round a whole number for IV. All right, so pay attention and work methodically through these problems, because they're all essentially the same. It's just make sure what belongs on top is on top and what's on bottom is on bottom. All right, now I'm going to do just one last problem that throws some people off, that you freak out when you receive weight-based problems. And I don't know what number that was. It was in part 1, the last one, Stacy.
Okay, it's number 7.
All right, number 7 in part 1. I don't know what page that is. I think it's page 2. Let's talk about weight, but it's going to be your standard problems. But before we put it into Doctor on Top overhand, we have a couple more steps to do, okay? Will you read me the problem, Stacy, or read it?
Solumedrol 1.5 milligrams per kilogram.
Solumedrol 1.5 what?
Milligrams per kilogram.
Milligrams per kilogram.
Is ordered for a child who weighs.
And the child weighs
74.8 pounds.
74.8 pounds.
Okay. Solumedrol is available.
It's available.
At 125 milligrams.
125 milligrams.
Per 2 mLs.
Per 2 mLs. All right. So the very first thing before we can get over our doctor overhand is we're going to have to deal with this child's weight, okay? Because you can see what the doctor has ordered. It exists in kilograms. Well, you already know, how am I going to convert that to kilograms? And you know, what are you going to divide by? 74.8 divided by what number? Oh, very good, 2.2. And if you do that on your calculator, that should come out to, is it 34? That comes out to 34 kilograms, all right? So I've taken care of this. I don't need to worry about it anymore. I have 34 kilograms. Now I can start step 2, which is let's plug it in where it says kilograms to get what the doctor ordered. So what I'm going to do now is, the doctor said per kilogram, and I can say, wonderful, I know what my kilograms are. It is 34 kilograms. But per simply means, what am I going to do? Multiply or divide? So whenever you see the word per, all right, that simply means multiply. So I'm going to say 1.5 milligrams times 34 kilograms is how much? And off the top of my head, it should be 51-ish. Am I right?
Hang on, just make sure. Yeah.
51. Okay? All right, now I did step 2. I converted out and I plugged it into what the doctor ordered, and now I know what the doctor ordered. Okay? I have 51 milligrams. Okay? All right, per kilogram. All right, now it's our standard problem of the doctor is on top. So what did the doctor order, please? We have the doctor is on top. The doctor ordered 51 milligrams. And what do I have on hand or available? I have 125 milligrams per. Remember, whenever you see the word per, it's opposite. Okay? So, and you can put whatever you want in that blank space. Now, the next thing I want to ask myself is, remember I wrote down my units, and that's why I keep telling you write down your units to make sure you don't have to convert. And they match, so I can cross them out, and I'm left with milliliters, correct? So 51 times 2 is what? 102. And 125 times blank X, nothing's there, is 125, correct? Remember in your calculator, what are you going to enter first? 102 or 125? Help me. Oh, very good. 102 goes inside the calculator first, divided by 125, and my answer is
0.816.
0.816, and I love it. Know why? Because you have to round. All right, now, this is not an IV problem. So whenever it's not an IV problem, for everything else, I am going to the hundredths category. So if you were to round this, remember we have tenths, hundredths, thousandths. Here's our hundredths. We have to go next door to the right to see if it's greater or less than 5, and we know 6 is greater than 5. So how am I going to round this? Our final answer is 0.82. All right? So listen, you need to calm down, because all I did was divide that by 2.2, and then I plugged it in using the normal formula. All right, so there's no need to get upset about weight. There's no need to get upset about any of this, or nervous, because you already know, if you know what belongs on top and bottom, you can answer anything. Do you have any questions? Now, I don't know if you noticed, but on that paper I gave you the answer sheet at the end. Now, remember, in your old level 2 and level 3, they have several different practice problems that you can work through, and they also provided you the answers as well. So if at any time you're working through those practice problems and you're not getting them right and you don't understand and don't know how to set it up, you're more than welcome to email me, but do not email me 10 minutes before tomorrow's test, so you'll have till 5 o'clock today if you want feedback from me.